Hello friends and dear viewers, this is Dr. Kiran Sekhar. I am the Chief Consultant at Kiran Infertility Center, Hyderabad. We have a dedicated hospital to take care of the infertile patients in Hyderabad, and we have other centers in Bangalore and Chennai also. We have another center in Hyderabad which is located at Manikonda. Infertility is a very taxing and new field in the sense that people who do not have children, they are having a lot of problems, psychological problems, emotional problems and family pressures. We have dedicated ourselves to the treatment of these couples. I wanted to bring you a very new advent or a very new innovation in the field of infertility, which is called as egg freezing. As you all are aware scientifically to know that a baby is formed from the combination of the sperm and the egg. The egg comes from the lady and the sperm comes from the male partner in the marriage. Now these eggs become less and less as the lady's age advances. So at birth, when the girl is a newborn baby, she has about 1 million eggs. But slowly at the age of 30, 90% of her eggs are totally lost and the egg reserves come down. One of the major problems we are facing in our infertility practice nowadays is when the girl comes at around 30-35 years of age. Between that age, we see the egg numbers on ultrasonography and we see the numbers on hormonal evaluation also, and these numbers have completely come down. Other social factors which come into practice nowadays is the girls who are getting married very early in the age of 20-22, they are able to have a baby. But girls who are studying more, doing professional courses, not getting married till the age of 30-32, they are actually having a infertility problem because by the time they come to the doctor, their eggs are totally finished. So this has been happening over a last 4-5 years or 10 years, I can say, because of various factors like pollution in the air, plastic use, a lot of stress and strain during our lives, and also the girls who are undergoing a lot of changes in their life, living in the new cities and trying to practice their profession. A very good proposition from the infertility centers and the research done is that you can freeze your eggs. Supposing you are not able to get married and not able to find a good partner at the age of 28, 29 or before 30, you delay your marriage by another 3-4 years. By the time you settle down, earn money and you are able to look after the baby. That is the concept nowadays. So in such situations you can freeze your eggs. This is a simple procedure in the sense that you can go and contact a good IVF center. They will first do an ultrasonography for you on the pelvis and see how many eggs you have in each ovary. We can count eggs in each ovary. So once you count these eggs in the ovary and do certain blood tests like anti-Mullerian hormones and various other hormonal evaluations, we come to know that how much of egg reserve you have got. So if this egg reserve is coming down, then we give some injections to you and make your eggs. This takes about 10 to 12 days of injection per every day, and on the final day the eggs are taken out under general or local anesthesia, and these eggs can be preserved in minus 197 degrees centigrade. That is, when you freeze the eggs and make them totally stand still, these eggs can live for about another 10 to 15 years also. So now once you having cryopreserved your eggs, now you are totally at peace. You don't have any stress like I have to get married early, or even if you are married you have to start the family early even though you are not settled financially. So such thing is there. A lot of patients and lot of girls are coming forward to do this egg freezing procedures. Now you will ask me like what are the other setbacks or what are the other disadvantages or anything about this procedure. There are no disadvantages or not much of setbacks because this procedure is very patient friendly. Once you know about the center and you are familiar with the doctor, everything becomes very, very patient friendly, and these injections can be taken by you at home also, and you can come for a regular follow-up after every 3-4 days to the hospital and come on an empty stomach to take your eggs out by anesthesia. These eggs are handed over to the embryologist, that is the person who takes care of your eggs inside the lab. They will actually analyze all the eggs and see what stage of development they are, whether the eggs are mature or not, and all the mature eggs what they get, they will separate them, clean them up, and then actually categorize them into category A, B, and grades, which are the good eggs and which are not the very good eggs. So the good eggs will be taken and they will be frozen, as I told you earlier. Who are the girls who actually should come for this procedure? Now the girls who have to come for this procedure more when compared to others is that those who are having irregular periods, that indicates that maybe your ovarian reserve is not good. So girls who have got another condition called as an endometriosis. Endometriosis is a condition where you actually have some blood deposits of the menstrual fluid or the menstrual blood inside the pelvis, and some of the girls may be suffering from this. They will also have a less egg reserve. History of early menopause in the mother. If the mother has attained menopause early, then your eggs also may be becoming less in number. And if you are undergone any surgery on the ovary, like if the ovary has been punctured or the ovary has been cut for some other pathology or reason, then also you should come down and have your eggs preserved. And there is no actually any kind of a stigma attached to it, because now the whole public is becoming very aware of this situation and nobody actually can find fault with that. So this is a simple and easy procedure which I have brought to our audience today so that they can understand about this. I think many of the girls may be aware of this also, but to gain more information about this procedure, to understand more in depth about this procedure, you can always contact us at the given numbers below, and the other links you can actually approach and then see us. Thank you.